My philosophy for patient care centers on quality medical care, but that care has to be individualized. In pediatrics, one disease will present different ways in different age groups, and depending on the child's previous history, it will present differently and need different treatment plans. So it's really important to individualize the care of a patient. So my training all occurred right here on North State Street, my higher education. I went to Millsaps College for my undergrad, then went to the university for my medical school and for my residency. After that point, I went to the Mississippi Delta and practiced 28 years there in pediatrics. The last 10 years were solely pediatric hospitalist work in a community hospital. I started medical school just for my love of medicine and biology, but absolutely fell in love in pediatrics on my first pediatric rotations. Children are so full of life and so fun. Their main goal is to have fun, to play. And I was just really impressed in the resilience of children. I also love the pathophysiology of all the childhood illnesses, especially the respiratory illnesses. My passion for patients that are in the hospital really is not centered on a certain illness, but more so of hearing the whole story. I love to see the relief of parents when they actually are telling everything that they've been worried about. So I would say my passion would be just the storytelling that the parents can give me. So I spend a lot of my time outside the hospital with family. I have 3 grandsons that I spend a lot of time with, but I do have an unusual hobby. I'm a beekeeper. So I tend the hives, watch the bees work really hard to make the honey, and of course have the sweet deal of stealing the honey at the end of the season. My mission is to provide quality care for every patient, but to do that with a huge dose of compassion. And that compassion is not only for the child, but the whole family unit. When a child is admitted to the pediatric floor, the family unit is very disrupted at that point. And so there's a lot of care and compassion for every family member that's involved.